let's launch into our questions. So everybody has heard a little bit about your main responsibilities and your role, but if you could provide a brief overview of your respective company, and if you'd like, you could highlight a couple of other things that are part of your job. So to kick us off with that, Zoe.
Okay, good morning, everyone. Thank you, Julie and JAXUSA Partnership for having me today. I'm very happy to be here and joining this workforce briefing this quarter. So as Julie mentioned, I am the Senior Manager in Talent Acquisition, so I serve on the leadership team. My particular area of responsibility really focuses on talent engagement and outreach. So anything related to attracting and engaging new talent to come and join our organization. So that can include career fairs, events. We do a lot of work in the community, a lot of social media marketing. We also send out newsletters. We reach out to candidates as part of our sourcing strategies. And I also oversee the Guidewell Enterprise Internship Program, which we have about 13 different programs, which we'll talk about later during the panel discussion. That's really a heavy part of what I do is involving the internships. So our focus is on these strategic talent. So those really hard to fill, high critical needs to fill those hard to fill roles. So we have a strategic talent plan, working with leaders both internally and working with partnerships and organizations externally to fill that talent. So let me talk a little bit about Guidewell. Most people are very familiar with Florida Blue, but Guidewell is our family of companies. It's our non-for-profit mutual holding company. Florida Blue, which most people are familiar with, is one of our many family of companies, which happens to be the largest, and that's our health insurance company. So Guidewell is a family of health solutions companies that was put together and established in 2012. Florida Blue's actually been around for well over 75 years. So the Guidewell Mutual Holding Company, again, is a health solutions companies that serve more than 46 million people across the United States, Puerto Rico, and the U.S. Virgin Islands. Our enterprise is driven by a straightforward mission to help people and communities achieve better health. So we strongly believe that everyone deserves access to quality, affordable, and equitable healthcare, and that we must build a healthcare system that works for everyone. We also we have multiple companies under our umbrella. Our parent company, again, is Guidewell, but we have up to 10 forward-thinking companies that focus on advancing healthcare. So we look at the forefront of healthcare evolution by innovating, collaborating, and advocating for a healthcare system that works better for everyone. So Florida Blue is known as the leading health insurance company in Florida. Guidewell has about 18,000 employees total. Florida Blue makes up approximately 11,000 of our employees, and we're headquartered on the Deerwood campus, just near St. John's Town Center. Again, we serve over 46 million people across 45 states. That includes Washington, D.C., U.S. Virgin Islands, and Puerto Rico. Some of our other companies include the Triple S Management. They're a leading healthcare services company in Puerto Rico. We acquired them last year. We also have the Florida Blue Foundation, which is a philanthropic affiliate. They're committed to delivering on Guidewell's mission. We also have Guidewell Health, which is a portfolio of clinical delivery organizations, so more patient-facing patient care. We also have Guidewell Venture Group, which is a portfolio of companies. It includes On Life Health, Pop Healthcare, and they're focused on creating human-first, innovative healthcare solutions for health plans. Two more, Guidewell Source, they're a provider of administrative services for state and federal healthcare programs, including Medicare. And last but not least, we have WebTPA, which is a market leading administrator. They focus on self-funded employer health plans.
Very good. Well, I think that probably provides some additional clarity around the structure and how Guidewell and Florida Blue are part of this family of healthcare services. So thank you for sharing that, Zoe. Ben, let's hear from you.
Good morning, everyone, and thanks for having me. So maybe I'll start with maybe the organization. I'll get to my role in the organization. So for those of you who don't know, Mayo Clinic is a nonprofit healthcare organization with 3 destination sites: Northeast Florida, Phoenix, Arizona, and Rochester, Minnesota, in a health system in the Midwest. We employ about 70,000 employees across the organization. Our focus is on 3 things: the 3 shields of Mayo Clinic: patient care, education, and research. And our primary mission is needs the patient come first. Northeast Florida, we have about 9,000 employees and students, about 780 physicians and scientists. Just for reference, about 8 years ago, we were only at about 5,000. So we are growing in this region, which is nice to see. Mayo Clinic as an organization was ranked as #1 in U.S. News World Reports, also ranked #1 in Florida. So that's a nice thing to have. What's not known to folks is we do have the education and research component of that, and that's part of our practice, and that is integral to what we do. Typical academic medical centers, the research is kind of the primary driver. At Mayo Clinic, the primary driver is needs the patient come first. As far as my role in the organization, as you heard, I'm the chair of HR in Florida. So my primary focus is supporting the people strategy in Florida in alignment with the institutional people strategy. In addition, I support our international work, our people analytics team for the organization, support for research education across the organization. And then we have a couple of growth businesses called the Center for Digital Health and Platform, which I also provide support for those groups.
Fantastic. Thank you for sharing that information. And as everybody on the call can clearly see, you both are extremely busy. And that's, again, why we're so grateful that you were able to join us here this morning to share your insight. So a primary question that a lot of folks have is, how do people get into this field? What are some common entry-level jobs that would be great suggestions that we could make to those individuals who are thinking that life sciences is of interest to them professionally? So Ben, if you could kick us off with your response.
Certainly. I can't speak for most, but I'll give you some examples of how folks got into this field, at least in my experience. One primary is that folks have had experiences with the organization. A loved one or themselves had care here, and that really drove them to say, hey, I want to be part of that. Myself, I got involved in Mayo Clinic because my mother worked here many years ago. Others have a passion for healthcare, that I want to be a doctor or nurse. But what really is not known is there's a lot of other fields that you wouldn't think of in healthcare organizations, such as IT, finance, human resources, that exist, marketing, business development. So those are some things how. And so I think it's more of a barrier. Sometimes folks don't think, well, I'm not a nurse or a doctor, therefore there's nothing there for me. And in reality, there's a lot here for you. We have over 3,000 distinct jobs in this organization. So there are opportunities, it's just looking for them. As far as entry-level roles, there are many entry-level roles, patient care and non-patient care. So even if you don't want to be patient care, I've never touched a patient or been part of patient care, and I've been here 24 years. So there are plenty of opportunities, but a nursing assistant, a surgical tech, pharmacy technician, a phlebotomist, a data coordinator, scheduling operations individuals. Those are some examples of those, both bachelor's degree type of roles and those even who do not have bachelor's degrees, associate's degrees, or even high school diplomas as well.
Fantastic. Thank you for those ideas and suggestions. Zoe, what are you seeing?
So I would give you a little bit of an out of the box answer on this. Really, people join Guidewell Florida Blue based off their passion, the passion around our mission. So people join our mission, or any company's mission based on their passion. So people join a mission based on the company and grow when they are passionate. So we do a lot of work in the community. We're out there in the community providing all sorts of, social and community type of offerings, a lot of engagement locally across the entire state of Florida. And many people are familiar with Florida Blue healthcare insurance, and that leads them to us because either a parent has Florida Blue healthcare insurance, or they know of a family member who has the healthcare insurance, and then they learn through that what our mission is all about. It is a corporate environment, so there's not one singular way for any individual to enter into the organization. What I could tell you is we have job opportunities that range from business operations, clinical, compliance, customer service and claims. We have finance, innovation and strategy, product, sales and marketing, and of course, technology is very, very big. But if I had to name any specific entry-level roles that are good or that are most common, that would be in our service sector. Our service sector of the business, when I say service, that's our customer service. So we're talking about patient advocates, member advocates, member service advocates, provider service representatives. So these people help our patients and help our members navigate their healthcare plans, their healthcare needs, in order to improve the health of themselves and their family. So this area of entry is extremely helpful for anyone starting within Florida Blue, because it builds a very solid understanding of our business, and it also prepares them for future roles with a broader scope and accountability. So it really helps them grow in their career.
That's fantastic. I really appreciate the fact that both of you touched on, it's not just the passion for the job and the role, but it's also having seen other people in the family experience positive care, having a great experience despite difficulties maybe that one of their loved ones is going through, but yet seeing the care that was provided from each of your respective organizations. So, and also the potential entry points and how those can be a launching pad for further career pathway development, I think is really helpful to be aware of. So thank you both for sharing that. Another question that a lot of us have when we're thinking about how do we guide people through a career pathway, and certainly this time of year, it becomes very important to consider as we all are approaching the time of graduation, high school graduation specifically. So will your company hire high school graduates? And if yes, can you share some of those roles? And Zoe, please go ahead and respond to this question.
Sure. Okay. So we have several opportunities for high school graduates. So I'll name a few, not all, but one in particular, I mentioned customer service roles. So our service advocates, we do hire high volume every year, several hundred customer service advocates every year. And this does not require, 5 to 10 years of experience. So we do hire individuals right out of high school or in their early college programs. We also provide all the training that the individuals need. It's about a 12 to 13 week training program. And through that program, you learn all of our systems, you learn how to really understand our different healthcare plans, how to answer the phones. It's similar to a call center type environment, but you get to work from home. You don't need to be in a call center. So we're pretty much Florida Blue, Guidewell, we're in a hybrid work environment where 90% of us are pretty much working from home. I'm from home right now. I go out, on occasion to events and things like that, but most of us are at home. You could choose to work in the office if you'd like, it's totally your option. But so that customer service role is really taking calls all day, and every call is a little bit different. Every call, you really have to have empathy and passion because some of these calls are difficult. Some of the members are going through a difficult time. So we're looking for individuals who really have empathy, and have that kind of customer first focus. But again, we provide all the training, we provide all the equipment, technology you need, and you learn all the different systems and platforms so you're able to navigate and answer the members' questions. So that's one entry-level position for high school students. Another option is we have what we call our Partners in Education and Business program. This has been ongoing since 1991. It's a partnership with Duval High Schools. We have 3 different high schools currently in play, actually 2 in Duval and 1 in Broward County, South Florida. And they come into our service center as well, and they learn all about the claims department, our member contact center. They intern with us during high school, and upon graduation from high school, they have 2 options. They can either rotate into and convert into a full-time position in our customer service center, or we have the Follow You to College program, where if they decide they're going off to college, they can still continue to work with us part-time while they're attending their college degree program. So that's another option. A third option, and this is the last one I'll mention for now, is our IT apprenticeship program. So we have a huge IT department. Many people don't really connect Florida Blue with IT or technology, but that's probably the biggest part of our business, our big IT department. There's 9 different IT tracks across the technology team, anything ranging from cybersecurity to infrastructure to application development to IT project management, business analysts, testers. So for the IT apprenticeship program for high school graduates specifically, they are looking for high school students or early career individuals to fill those apprenticeship roles. And they're looking for business analysts, testers, and to build developers out of that program. So 3 options there. There's others, but those are the top 3 at the moment.
Well, those are fantastic opportunities, and kind of going back to something that Carol had mentioned, you know, these apprenticeship opportunities are real jobs and they're real opportunities. And so often I think the narrative is that if you're in an apprenticeship, it's automatically just defaulting to a skilled trades, which those are fantastic opportunities as well. But I like that there's an apprenticeship opportunity in the IT space as well that's available to our region's high school graduates, in addition to these other programs as well. So thank you, Zoe, for sharing that. Ben, will Mayo hire high school graduates? And if so, what roles?
They will, and I probably answered some of this question in my previous answer, but I'll try and give some different roles. But a couple of things to think about. Administrative assistant, and I'll come back to that one in a minute. Desk operations specialists, which really help with scheduling patients. Clinical assistants, health unit coordinators, nursing assistants, general service. And general service is folks that help escort patients, help with getting out of vehicles, escorting wheelchairs, et cetera. Facilities has monitoring technicians. So there's a variety of roles that only require a high school diploma. But I think the key, though, is we have a program called the Career Investment Program that provides eligible staff opportunity to build their skills in partnership with other schools. You know, we have a partnership with FSCJ that helps do that. And that allows them to get a degree at no cost to them. So I mentioned administrative assistant in particular. So my administrative assistant, who I hired maybe 6 years ago, finished her degree, became a program manager, and now is an operations manager. So in 6 years, she's progressed quite rapidly. Now, that part of that's due to the fact that she's really good, but the opportunity exists to cut across different groups. And so she went from research to education. So there's a lot of different opportunities. So I would encourage folks that if you're looking to, hey, maybe I want to see what I want to get into, getting a job and starting, there are a lot of benefits to go back to school or gain new skills.
And that's, again, a critical thing that you're sharing. I'm sure all of us have had conversations with students or even adults in career transition that are saying, you know, I can't afford the cost of attending any kind of post-secondary institution. Here's a great opportunity for somebody to get in the life sciences industry, take advantage of, you know, free tuition and seeing themselves maybe even use transferable skills within the organization, certainly really exploring the career pathway and the different types of roles that are available. So thank you, Ben, for sharing that opportunity with all of us on the call. Our next question. So this kind of goes toward the non-clinical career pathways that people may be interested in. If you could share an example of a non-clinical pathway, maybe that people don't often associate with a career in life sciences, and are there classes in college or high school that would be helpful to take? Maybe as people are kind of thinking, am I interested in this industry? If so, how should I really be preparing myself well? So let's look at some of those non-clinical pathways, maybe that people aren't thinking about and how they can get there successfully. And Ben, let's hear from you.
That's a broad question. I will go back to the earlier response of the why is always is critical. The why, what you want, the why first, then the what. And I know sometimes you have to do the what to figure out where the why resides, but that's the first thing. I'll use example HR. Myself, I never ever wanted to get into healthcare. That wasn't my plan. I got into healthcare because of really just an opportunity. And I started doing recruitment, which, you don't always really think about from a healthcare organization, but it's critical, as we all know. Went from recruitment to then more employee relations type of stuff, then labor relations roles, and then went from that to research, which had nothing to do with HR. Didn't know research existed. Didn't know what it was. So that's a pathway. IT is one also that I think Zoe mentioned. Well, folks don't really associate that, but there is a humongous IT component to healthcare. And it's only going to grow with remote work, with remote care, a lot more efforts to provide hospital level care in the home. That requires a lot of infrastructure, as you can imagine. Marketing, a lot of folks wouldn't think you have marketing in a health organization. That's a pathway. Communications, another one where you would think of, hey, that doesn't really fit. But I have a communications colleague who started in communications, is now a vice chair in research. So there's different pathways everyone takes, and that's the beauty of this organization in particular is you can have multiple careers in one career. As I mentioned, I've been with this organization almost 24 years. My intention was to come for 5 and leave, and so obviously it didn't work. So there are different ways to get through and out, and a lot of times we also try to encourage stretch assignments or assignments outside of your current role to see, hey, that might be something I want to do. So there's plenty of opportunity for those. I think the key thing is, if you're interested in a job, check out the website, because there might be something you wouldn't think in healthcare actually does exist.
That's fantastic. Thank you for sharing those very specific examples of how some of those career pathways can come into being. I like the idea of the stretch assignments, and certainly you all must be doing a great job with employee retention, because 5 has turned into 24 years. So that's fantastic to hear, Ben. Zoe, let's hear from you.
Okay, so I would say kind of non-clinical pathways. I kind of mentioned broad categories. Going back to technology, again, application development and IT developers, these are areas that are truly high demand positions and very, very difficult to fill. So if you're in a position where you have the opportunity, whether it's in high school, whether it's in college, to learn programming, coding, to learn the developer language, whether that's Python, whether that's Java, I would say our technology at Florida Blue is well over my head when it comes to this area, but we looked for mid to senior level individuals in these areas, but we would love to start them early because we have an internal program to grow the skills of our entry level IT developers to become those mid to senior level. So our technology can include anything from React, Node, AWS platform, Spark, Scala developers. I mean, it's pretty advanced, meaning it's over my head. I don't even know what half of those really mean, honestly. I'm not IT, but there's a huge demand for that. So if there's an opportunity to go that route, that would be an opportunity that I would encourage. Another is around data and information. So data analysts, data scientists, health business analysts, all this information, all research, putting together the analytics. It's a huge part of the life sciences that people don't normally associate. Data scientists and data analytics are also considered very high demand positions that are strategic positions, and critical talent needs that Florida Blue looks for and are very difficult to find. So if you're looking to get into a niche where you would really do well in growing your career, those would be the areas that are non-clinical that I would focus on.
Okay, fantastic. So as far as translating that into classes and coursework, we're thinking anything that gives exposure to technology, exposure to crunching numbers, statistics, data projections, even something as basic as Excel spreadsheets, because just having a really solid understanding of how to utilize Excel is kind of a foundational skill that's needed in these various roles that become much more complex, we understand, but just in thinking about how students can kind of begin gathering that baseline knowledge and getting themselves in that space where it's not such a big leap to say, yes, I want to become a data scientist in the healthcare space, that kind of thing. Okay, fantastic. Moving on to our next question. Is there an emerging role in your organization that is emerging due to changing needs for patient, provider, or both? So Ben, could you shed some light on emerging roles, please?
Sure, I can. I think before I get to emerging roles, though, there's also going to be just a shortage of regular roles. So I don't know if you have been in the state of Florida. By 2035, we expect to be down about 60,000 nurses. So those roles are still critically important. Surgical services, critical care, emergency room, paramedics, some of those types of roles. As far as emerging, I think one of the most interesting emerging things in healthcare is two components. One is AI, and one is this remote work or remote care, and how to have that skill set be a little bit different. If I'm a provider and I'm treating a patient who's hospital acuity but is at home, is a little different skill set than maybe I'm used to being in the bricks and mortar type of setting. AI also, that whole tie between AI and providers. AI will not take the place of physicians or nurses, but how to utilize that. The other part is how do we use robotics, not for procedural things, but for things that don't need to be done by a person, so a person can spend more time dealing with patients. So transporting linens from storage to a room, does that have to be done by a person? Probably not. Some of those types of roles and innovation, kind of thinking through that.
Fantastic. Thank you for sharing that perspective. And yes, we still have to keep in mind that some of the roles, like nurses, we still need those. Those aren't going away. But the industry does continue to evolve and provide different types of opportunities. So thank you for pointing that out, Ben. Zoe, let's hear from you.
I would say 3 areas of emerging roles. Mental health. So anything we're really always hiring for licensed clinical social workers, mental health counselors, specialists of that nature. And this is an area, of course, with COVID and when that hit and it continues to grow, I'm trying to even find licensed therapists and schedule with them is very, very difficult because they are all completely maxed out with their patients and patient care. So that's an emerging role. I would also say medical assistants. So we have a high need for medical assistants in our clinical areas. One of our companies is a diagnostic clinical medical group located in Tampa. Another one is Florida Healthcare Plan. They're located in Daytona, and medical assistance is an area where we consistently see a need for that level of patient care. Also, patient advocates. That would be another area where that's an emerging role that we will continue to need and will grow from well into the future and beyond.
Okay, fantastic. That's a great perspective as well, Zoe. Thank you. So moving on to our next question, the skills, abilities, and personal attributes that are essential to success um, in this field. So we're thinking about employability skills, soft skills. Every employer in every industry tells us this is absolutely critical, but we also like to drill down to see if there are some nuances within those skills required within industries specifically. So if you can share some of those things that you see, particularly in your roles, that would be fantastic. So Zoe?
Well, I mentioned a couple of these previously, empathy, especially when it comes to patient care, member care, customer care. Empathy is a huge soft skill that's necessary. Also critical thinking. Whether you're in a technology role, whether you're in a sales marketing role, whether you're in a data scientist role, whatever the role, having high critical thinking skills is extremely important to be successful. Passion, really having a passion for our mission to help people and communities achieve better health. There's so many opportunities to be engaged and to be involved and to even volunteer within Florida Blue. We even have volunteer days, and we have community events locally and across, Florida region weekly. I know this because I oversee our community events as it relates to talent, and we attend well over 100 events just for talent alone. But that's not including all of the events that the leaders attend and all the different organizations, partnerships, the boards that our leaders serve on. Some other skills, well, I would really like to mention our core values. And if your core values meet with our core values, or if they're really speak to you, that's important. So I did want to mention our core values. So I call it ICE because there's 3 I's in there, and we added an additional I last year. So it's ICE, but it's respect, integrity, imagination, inclusion, courage, and excellence. So if those core values, which are very, very strong within our family, within our company, if those speak to you and you feel that those align to your personal or professional values, then I think that would be something that you should really consider, applying and joining a career with Guidewell Florida Blue.
That's fantastic. And I have to tell you, when I'm in a classroom speaking with students, part of the EarnUp website allows them to actually click on, employer websites directly. And one thing I encourage them to do is look at the core values and see if that does align with what they want. And I will say that there's a lot of nodding heads. They get it, and they see that as being very, very important in their selection of a company. So thank you for pointing that out. Ben, let's hear from you.
So I would say the first thing is mission driven. So that's the main goal we have. And we too have our values. And of course, a lot of them overlap. And so, real quick aside, the Mayo values really stem from the organization was founded by Dr. Mayo and the Sisters of St. Francis, which at that time, you didn't typically have Catholics and non-Catholics interact, let alone male and female interact. But they worked together to build the Mayo Clinic Hospital. That's where we got it from. And so our values come from the Franciscan values. Our acronym is RICH TIES, which you'll see a lot of the things overlap with what Zoe had said, is respect, integrity, passion, healing, teamwork, innovation, excellence, and stewardship. So mission-driven, tied to our values, similar to Zoe. Some other things to think about too is empathy. I agree with empathy. Honesty and integrity are the key things that really drive that, no matter what role you're in. The other piece is that our organization is very team-based. Our physicians are paid a salary. They're not paid based upon volume. And so that teamwork, team-based mentality across disciplines is also critical, no matter if you are a physician, if you're a desk attendant, if you're an IT person, all of those things are expected that you work cross discipline. The other piece too, I would say passionate, I agree with Zoe on that one as well. She stole my thunder, so.
Well, that just shows how important those sort of things are to everybody, regardless of if they're in a patient care or non-patient care role. And certainly, you know, teamwork, all of the skills that go along with being that team member as well. So there are so many like subsets of some of these things that you're mentioning, but I know that our educators are definitely committed to helping develop these skills in their classroom so that when students are out in the workforce, they're ready to do those things for you all. All right, our next question. And we have touched a little bit on this, but this is maybe where if you've talked about your programs, you could perhaps share a success story of some of your student interns. Does your organization offer internships or apprenticeships? And if so, could you just kind of explain that structure, how students can apply for these opportunities, particularly when they should be applying so that they meet deadlines? And certainly, if you'd like to share some success stories of interns that were actually offered full-time roles following completion of their internship or apprenticeship, I think that would be great to share as well. Zoe.
Well, I can talk about internships literally all day long. So this will be hard for me to summarize this in a very short, because we do have 13 programs. So let me just do a high level overview and we can certainly dive deeper if necessary. But okay, so everyone knows about your traditional college internship programs over the summer. Of course, we have that. They're actually coming in May 15th, and they start with us on May 15th every year around that time frame in May, and they're here for 12 to 13 weeks. So these are your undergraduate students for the most part. However, we do also hire graduate students. We bring in anywhere from, well, I would say over 100 college students every summer. So our main recruiting time for that, we start recruiting the fall of the previous year. So this fall of 2023, we will start our recruiting and career fair efforts for the following summer of 2024. And they're across all different business areas. So those internships for the summer 2024, they will start being posted in September timeframe. And then we do our roadshow and go all around all the different universities and colleges, and we promote the opportunity and engage students to apply for our programs. We do also have internships throughout the year now. It's not just the summer. So we have internship opportunities happening all year round. Some are 2-3 months, some are part-time, some are full-time. So if you go to careers.guidewell.com, you will see these opportunities pop up throughout the year, not just for the summer of 2024. We bring in anywhere from high school students through various high school programs to undergraduate degree college students to college students. We also are now bringing in military active duty service interns as part of our Department of Defense Military Skill Bridge program. Since I'm military, that was one of my programs that we initiated last year, and we're piloting in the IT area for this year. Let's see, what else do we have? Oh, we also have micro internships. So micro internships, we work through Parker Dewey. And if you can't do a full-time internship or even a part-time internship, you could do a project-based micro internship. So you can apply for those positions through the Parker Dewey website when those become available. We also have externships for individuals who are looking to become medical assistants, who are in medical assistant degree program or a curriculum. We also have radiologists, imaging externships, medical coding and billing externships. So the list goes on and on. We could talk about that for hours, all the different programs and what we have to offer. Another program, we have a 2 to 3 year internship program through our Equity Alliance program. It's called Leadership Equity Alliance Program, LEAP. And this is specifically to attract diverse students into our organization and to convert them into full-time leadership roles after their 3-year internship has completed. So we really focus on working with an organization called Inroads, and we bring in students from the HBCUs and other Florida schools throughout the state. One success story that just literally happened yesterday. We have a young man through Inroads joined our initial LEAP program in 2021. So he is ending his 2-year internship program, and he's graduating at the end of this month from the University of Florida. He's started out as a finance major, transitioned over to a business major. Again, he's been working successfully with us for the past 2 years, full-time during the summer, part-time while he's going through school. And he was just offered a full-time position with us yesterday. So he'll be joining us as a full-time employee, and we're going to be converting him over to full-time on May 15th. So he could start his new career with us, and he's working under our finance team. So super exciting there. We had a 60% conversion rate last year of interns converting into full-time positions with us. That was doubled from the year prior. So with that being said, we're really expanding and growing leaps and bounds when it comes to the focus and emphasis on our interns, growing their careers, and really focus on converting them into full-time, long-term careers within the organization. So again, we could have a whole separate panel discussion just on internships, and I'd be happy to do that one day, Julie, if you'd like.
Well, that does sound fun, because certainly we're always trying to promote to students this idea of this internship is such a tremendous opportunity to begin building your skill set, your professional network. And by the way, it could result in that full-time job offer and a seamless transition, just like your success story is going to experience. I think that's fantastic. And so happy to hear about the conversion rate. I do think that our students in our talent pipeline are really encouraged when they see a company making an investment in them and giving them those initial opportunities. I feel like that is definitely not only a recruitment strategy, but a great retention strategy as well. We're seeing that from students as far as their perspective when they look at companies. So thank you for sharing that. And the idea of the micro internship. So for anybody on the call, if you have a student that says, I can't commit to a full-time summer internship opportunity, the micro internship might be a great opportunity for them to still have that kind of experience. So thank you, Zoe, for sharing that. Ben, let's hear from you.
Yeah, so we have some centralized internship programs and a lot of decentralized. So I probably couldn't tell you everything that's going on yet, because I'm still wrapping my head around all that happens here. But we do participate in the military one as well. We do have administrative internships for the typical summertime. There is this program called the Summer Undergraduate Research Fellowship, the SURF program, which provides a paid research experience. There's also clinical research experience internships. We also have a graduate program called the Administrative Fellowship Program, the 2-year postgraduate degree program that folks rotate for 2 years through multiple different things, both practice as well as not practice. That program is quite successful. As the CAO of Florida, CAO of Arizona, CAO in Rochester, CAO of Mayo Clinic Health Systems, all are former administrative fellows. So the goal is to try and retain them. The administrative fellowship, there are some summertime ones as well as a full year that can happen as well. The best way to find them is to go to our website at jobs.mayoclinic.org and look at all the programs that we have. We're still in the process too of trying to, how do you centralize things, because a department can do their own thing and not have to work through, which is great, invest in the community, but wrangling all that together is something that we're still working through. So my apologies for not having as succinct of an answer as Zoe is, and again, as we continue to grow in Florida, we have more opportunities. Obviously, if folks aren't bound to the geography here, there's a lot more opportunity in the overall Mayo Clinic. So if there's that interest as well, there's a lot of programs and apprenticeships in the Midwest, but again, in Florida, no formal apprenticeships yet, but again, as we grow the workforce and continue to grow the campus, we'll continue to provide more programs.
That's fantastic. And you do have a wonderful resource here with CareerSource Northeast Florida as far as building out those apprenticeships. And I'm assuming also for the apprenticeships at Mayo, it's kind of a, apply in the fall for the following spring or summer. So we just need to make sure that we're encouraging our students to think about that early. So, 2 weeks before summer vacation, they're not saying, hey, I think I'd like an internship. So we definitely know we need to be promoting that, getting students exploring both of the respective websites that you mentioned. And certainly you could feel free to put that in the chat as well. We'll have that in our notes and in our recording, but feel free if you would like to put that in the chat. So moving on to our next question. If you could share some exciting industry trends involving technology and innovation that the audience may or may not know about. We've kind of skirted this topic with some AI, robotics, that sort of thing, but maybe is there something going on we have not talked about yet, and maybe even some potential roles or opportunities that are going to be cropping up as a result of these things? So Zoe, could you take that question, please?
I will do my best. So this area, again, technology, not my area. I'm HR, I'm in recruiting. But have you heard of something called Chat GPT? Chat GPT. So it's an AI chatbot that uses natural language processing, and it creates like a human-like conversational dialogue. So it's kind of like a language model that they actually could respond to questions and compose, written content, that it can include articles, social media posts, essays, codes, and emails. So that's something that's kind of an industry trend that's coming down from a technology perspective that would allow a chat bot to be able to communicate with members for their health plans or with patients regarding their healthcare. So that's something of interest that's coming down the pike. I don't know much about it because I'm not a techie, but that's something to consider. Another thing that we've been looking at are both what we call customer and patient journeys. So we look at the whole journey of the experience of the customer and the patient, the complete cycle from end to end. So we work very closely with processes and enablers to kind of meet our enterprise strategy and our different commercial segment objectives. So the journeys, it helps us set our strategies, our targets, our timelines. It helps us define our customer needs. And helps us launch new journey features, and we work within the different channels and processes to execute those journey features. So some things that Florida Blue has done in these journeys, they do their research first. So they research is done with the customers across the entire state. And they're written, the customer journey is written from the customer perspective. So the primary research is customer interviews, customer surveys, all different types of surveys, post-call surveys, digital surveys, relationship surveys. We also get feedback from millions of customer feedback. We explore the different customer touch points. And we look across all the different segments. We also do internal and external research around healthcare customers and their journeys to really understand the customer needs. And then we really look at the different channels across the customer journey. There's multiple different channels around research and shopping and renewing your insurance, how to maintain your eligibility, understanding what they bought and what that means, how they find care, how they get care, how they pay for their care. And then we look in each of the channels across the organization to ensure that we are providing the best possible experience for our customers. We look at all avenues across Florida Blue. on how we engage with the customers, whether that's in the contact center, whether it's technology, whether it's in our retail centers, whether it's email, text, whether it's with a licensed healthcare sales agent, whether it's with a provider, whether it's with a vendor. And we take all that information and I mean, really, it's the channels are all the avenues that Florida Blue has to engage with the customers. And they are the customer facing touch point with each members that we interact with. And then we look how we can improve that experience across each area and segment of that journey to make the experience as best as possible and provide the best care possible to our members.
It's really interesting. So the chat GPT and then the customer and patient journeys, just thinking about traits that folks on the call may see with their students or the population of folks they're working with, if they have an orientation toward troubleshooting, process improvement, process orientation, curiosity, I think all of those skills would lend themselves well to both of those things that you're speaking about. Now, Ben, let's hear from you.
So chat GPT has already been taken. But that also is part of it. I think the bigger question or bigger trend is AI, or really big data. And why that's important really is it's being utilized to improve, for example, transplant outcomes, using that comparison to have better matches between patients and donors, really trying to leverage, if you think about it, for example, we have 9 million IT transactions per day in this organization. And so how do you use big data to try and provide things? For example, we also did a partnership with Mercy Health to combine de-identified patient data across organizations. And why that's important is now you broaden your population of patients so you can better weed out bias and have a broader cohort to really predict disease much earlier on, as opposed to waiting for things to occur. And so that whole data space is going to be critical. And how do you take all that information and actually make something useful out of it? The other piece of that is how do we make sure that algorithms and things aren't implicitly biased? And so folks focusing on those types of things as well.
That's fantastic. I had heard that the average individual has, I think it was 250 to 300,000 data points in their medical record. So when you're talking about, I mean, you mentioned transactions, let alone all of the data points. What do you do with all of that? How do you make sense of all of it? So again, if you've got that student that is curious, does have that thought about troubleshooting, process orientation, how do I make sense of something that currently doesn't so that it has meaning? I think there's going to be some great opportunities based on what you both have shared in the industry.
I would add, Julie, too, the other piece is going to be the information security component of that as well, to make sure that data is secure in those types of fields as well, because data exists everywhere, and the more and more we have, we've got to make sure we protect it.
Exactly, 100%. So those cybersecurity roles, absolutely critical, because we want every single one of our 250,000 data points to be protected 24/7. And so we rely on those professionals with those skills to do that. So in thinking about the future of your industry, the future of your organization, what does that look like nationally and specifically here in Northeast Florida? This is our last question today, and Ben is going to kick us off.
I think nationally, the key thing is, we all know healthcare is an expensive space. It's a fragmented space, and there's plenty of opportunity for that. So I think the key really is, how do we continue to provide cutting edge care efficiently? Also try to focus on the underserved, or those who are excluded from that group. As you know, that's a big challenge for underserved populations, not only in Florida, but across the nation, that we have to keep focusing on. But locally here in Northeast Florida, I'm excited. We recently purchased another 200 acres of land. So we have a 100-year plan to continue to grow to support Northeast Florida. And not only Northeast Florida, but again, destinations. We have patients from all over the world that come. But I also try to be a growing member of this community and really provide opportunity for employment and other things for the foreseeable future. The biggest challenge, of course, will be how do we navigate the landscape of ever-changing legislation, regulation, et cetera. But that's not unique to healthcare. I think that's across industries as well. But we're looking forward to the future for sure.
That's fantastic, and congratulations on the land purchase and your 100-year plan. And certainly something we have not touched on, but it's such a value add within this industry is medical tourism. What Ben's mentioning is absolutely correct. Because our healthcare system is so absolutely amazing, we have people from all over the world that will come here to Northeast Florida to take advantage of that care. So thank you, Ben, for touching on that. Zoe.
Oh, let's see. So, of course, the future for us, I mean, we're really focused on continuing to strive to reshape the healthcare experience. I would say that we are very, very strong in our presence in Northeast Florida with our market leaders, our different business leaders. We're strong across the state of Florida. From a national level, our CEO, Pat Garrity, who is amazing in every way. Pat Garrity, he engages with business leaders and policymakers through nonprofit, economic, and community organizations, such as Florida Council of 100 and also the National Institute of Healthcare Management. So he brings different diverse perspectives to the table to help forge, those long-term sustainable and innovative approaches to healthcare. So he's very active in Washington, D.C. and frequents Washington, D.C. To really help improve that healthcare journey and experience.